Hello and welcome back to Diverse Thinking, Different Learning. Thank you so much for joining us today. Today we are talking about teen anxiety. Anxiety among teens is rising, and it's something families and educators are navigating more than ever. So today I thought it was important to discuss how to recognize anxiety in teens, the factors contributing to its rise, and practical strategies for addressing it. Joining me today is Dr. Ashley Smith, an award-winning licensed psychologist, co-founder of Peak Mind, the Center for Psychological Strength, and an expert in anxiety. She's also the author of Childhood Anxiety Disorders and The Way I See It, A Psychologist's Guide to a Happier Life. Dr. Smith's professional expertise and personal experiences allow her to educate, inspire, and help others live bold, fulfilling lives. I'm so thrilled to have her here today. Let's get started.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Ashley, thank you so much for joining us today.
I'm so excited to be here. It's an important topic that we're talking about, and we've got lots to cover.
I know it is an important topic, and I'm so glad to have you here to share your insights because, more and more people are seeing and recognizing anxiety in children and teens. And in teens in particular, it can look like normal adolescence and normal adolescent challenges. Let's start by talking about how parents and maybe even educators can distinguish between typical stress and true anxiety.
Yeah, well, I think there's so much to unpack there, right? Because anxiety, it's a word that we use, but it's an umbrella term that covers so much stuff. So if we just start even with stress versus anxiety, because those words get used interchangeably, stress is a natural reaction to any demand for our time, attention, and energy. So teens have a bunch of it, right? They have homework, they have chores, they have social stuff, extracurriculars. So any demand is going to cause stress. And it's not necessarily a bad thing. Stress can actually be very adaptive, right? I like to think about if you want to get stronger, say from a muscular standpoint, you go to the gym and you tax your muscles. So you put them under stress so they grow. So stress can be a good thing from a psychological perspective because we can grow. Too much, not so much. So we see a lot of teens who are over scheduled, over committed, they're stressed out. And that's one concern that I think we really need to pay attention to. The difference between stress and anxiety, though, whereas stress is this reaction to demands, anxiety is danger, right? So anxiety can take a lot of different forms and flavors and ranging from different diagnoses to different presentations. But anxiety really has this, oh no, something bad is going to happen flavor. And you can put those two things together and we can talk about stress and anxiety interchangeably. And when I do with teens, I don't split hairs over this. I'm going to say, okay, we have anxiety. It's our body's warning system. Its whole job is to be on the lookout for things that could go wrong, things that could be bad, or things that could hurt us. And sometimes it's too good at its job. So all teens are going to have some stress. They're going to have some anxiety. It's normal to worry about fitting in to a certain extent. It's normal to worry about the future or doing well at school or what's going on in your family. What separates what I would call normative anxiety from anxiety disorder is, does the anxiety match the context? Meaning, yeah, this feels like most people would probably feel anxious or worried about that. Or is it excessive? And is the anxiety transient, meaning it kind of comes and goes? So it's short term based on the situation versus pervasive and it's there all the time. That's more disordered. And the biggest thing is it impacting their life? Is it getting in the way of them functioning, right? Like, is it getting in the way of them learning? You can't learn very well when you're anxious. Is it getting in the way of their academic performance or their social functioning or their ability to take care of themselves and pursue age appropriate independence? So I really look at that. What's the level and how big of an impact is it having?
Absolutely. And I love that you made that distinction between stress and anxiety, and also situational that comes and goes, and then that pervasive anxiety that seems to be always there. And for parents who might be listening, and I think they probably now have a clearer understanding of that distinction, when should they consider professional help for their teen or start having that discussion? Because it sounds like when it's impacting their lives and it's getting in the way, that's when you do that, correct?
Yeah. And my bias is to err on the side of sooner rather than later. So a lot of parents, one, just don't know that this is anxiety, that this is a real neurobiological condition, and it is really harmful and impactful to kids. They also tend to think, oh, they'll just grow out of it. And they won't. What actually happens with anxiety disorders is they get worse over time, not better over time. So I think early intervention is the way to go. And if you're not sure, hey, is this just my kid's stressed out, it's normal teen stuff, or anxiety disorder, I'd still err on the side of seeking out resources because we're seeing the rates of anxiety in teens skyrocket. It started, I mean, it's already been increasing. COVID did not help, and it's not really coming down now that things with COVID have sort of settled. It's there, and having unchecked anxiety raises your risk for depression and suicide, which is also huge concern. So I don't want to be alarmist by any means, but my bias is get help and resources sooner rather than later, because the more teens know about their nervous systems and their brains and how they work, the more parents understand, the better off everybody is going to be.
Absolutely. Absolutely. And it's interesting because for parents, sometimes the signs are not as obvious because a lot of teens internalize that anxiety and may not be saying what it is that they're experiencing. And I often see behaviors that individuals, teens are engaging in to combat that anxiety. And it looks like perfectionism. There's a lot of emotional dysregulation when things are not going well, avoidance. And so there are things that the parents should be aware of that may not look like the anxiety that they imagine in their minds.
I'm so glad you're bringing that up because that's a huge thing, right? You could have kids where on one end of the spectrum, it's the dysregulated kids, right? They're the ones that are melting down or getting aggressive or really angry when their anxiety is triggered. Those are a little harder to ignore. They don't go under the radar quite as much, but people don't think anxiety. They tend to think defiance or disrespect instead of saying, wait, where is this coming from? What triggered it? I bet it was an underlying fear. But to your point about perfectionism, yes, these are the kids that parents love and teachers love because they never have to be told to do their homework. They're on top of things. They're doing so many things and they look great. I read this, I forget what book it was, but someone was talking about the swimming duck phenomenon. They look very serene and peaceful on top of the water, but underneath the surface, they're just pedaling furiously. And that's what happens with a lot of anxious kids who are more people pleasers or worried about achievement and that flavor of anxiety. They look like rule followers until maybe they get past the point that that's when you might see the tears or the meltdown or they might open up. But otherwise, they look like they're doing great and they're struggling.
Absolutely. And it's at an emotional cost for them to keep it all together when there's so much going on internally.
Very much. Yeah. And then we see things, you mentioned avoidance, which is the hallmark of anxiety. So I use avoidance to really identify anxiety because some teens with anxiety, they can tell you, this is what I'm thinking. This is what I'm worried about. Though, if you ask, they will tell, and some will even volunteer, but a lot won't. No, I'm fine. Or no, it's not that big of a deal. They minimize, but if you look for the avoidance, and it could be overt avoidance, big things like I'm not going to school or I'm refusing to get my driver's license or get a job or go out with friends, but it can be subtle as well. I'm avoiding touching things because I'm worried about germs. I'm avoiding mistakes by rereading or taking a really long time on homework. I'm avoiding social awkwardness by not making eye contact or always having the phone out. And so avoidance can be the things you're not doing as well as the things you're doing to not feel uncomfortable.
Absolutely. And I love that you mentioned the phone, because so many young people I'm seeing are using that as a tool to avoid social situations that make them feel uncomfortable. They don't know
Oh,
what to
yeah.
say. They don't know what to do. They can take out that phone and just look at it, and no one will bother them because it looks like they're busy. Yes.
Yeah. And you can even see groups of teens hanging out and they're all on their phones. And sometimes they're interacting. So it's not necessarily that phones are evil and bad, but we do need to look at how they're being used, because there's a ton of research linking screens and social media to anxiety. And it's not a direct screens and social cause anxiety, but there's a huge connection there. And so I'm always talking with people about how are you using your technology and being sure that it's not mindless scrolling and doom scrolling. And it's the what are you taking in? Because social media can fuel comparisons, this fear of missing out, this susceptibility to cyberbullying. So there's a lot of bad stuff that can come through social. There's good stuff too. I have teens coming in saying, well, you know what, Dr. Ashley, what you're talking about sounds like this TikTok I saw. And I'm like, great. If it's accurate information and it's helping you realize you're not the only one and this is what to do about it, it can be a good tool. But the other thing, teens are on their phones at night and it's disrupting their sleep, and disrupted sleep raises the risk for anxiety and depression and a host of other things.
Yes. And we've talked a lot about sleep disturbance, and how necessary and important sleep is for overall well-being. And so I'm glad that you brought that up. In Jonathan Haidt's book, The Anxious Generation, which a lot of parents are holding as their Bibles right now, he highlights several cultural and societal shifts that have contributed to anxiety in teens. And you mentioned one of them, which is technology. Have you seen that in your practice in the teens that you work with, as a factor that's fueling this rise that you mentioned in teen anxiety?
Absolutely. So I started studying teen anxiety in 2002 in graduate school. So this was pre-smartphones, pre-social media. And there are some elements that really haven't changed in the last 20 plus years. But there have been a lot that have started to change. And from what I see, and this is anecdotal, I haven't run the studies, but I've certainly looked to some research to say, yeah, this isn't just my impression, but technology is one of the things that has dramatically changed. Social media is one of the things that has dramatically changed. And having those available during early adolescence, puberty, I know in The Anxious Generation, he talks about that. There have been some other things, like when we think about what's happened in the last 5 years, right? How many times did we hear the word unprecedented, starting with COVID? And then in the US, we've so much around inequity and inequality. There've been increasing polarization. There's climate change. So these young people are being bombarded with experiences that the world is a dangerous place. And we can't necessarily argue with it. I remember when my very first job out of graduate school was building an anxiety clinic at Omaha Children's Hospital. And I'd have people coming in and they were worried about school shootings. And at that time it was, oh, there's only been Columbine. That's it. What are the chances? It's very low. Fast forward to now, and kids are going to school and going through protocols. Some go through metal detectors. It's locked. You have to get buzzed in to go. And get your IDs checked, and there's security guards. This is a very real concern for them that we can't just chalk up to, that's just your anxiety talking. Don't worry about it. Right. So things have changed and it's impacting kids. And certainly there's an interaction between the technology and the news that they're getting, but things feel different.
They really do. And I love that you mentioned that technology is kind of a vehicle for providing all of that information to young people at a time when, generations before didn't have that. You had to wait till the 6:00 news to see anything. And at 6:00, you were probably upstairs doing your homework. So you weren't having access to what was happening in the world. But now they're getting notifications that things are happening all the time. And then they're scrolling often well into the night all of these things that are happening in the world. And there's just an increased awareness of all of the things that are happening and how it can impact their lives. And it creates, insecurity. It creates a fear, which is anxiety. And a lot of teens feel like there's this hopelessness and helplessness, which can often, result in depression in addition to anxiety.
Absolutely. And just run of the mill, if you have anxiety, you've more than a 50% chance you're going to develop depression too. They go hand in hand. It sucks to feel anxious all the time. And so it does start to lead to depression too. But certainly all of those factors that you're talking about. And then I also think there are some cultural attitudes that I think are shifting. I hope are shifting. But some of that, there's always the stigma with mental health and don't talk about it. And anxiety is a weakness. And why can't you just turn it off? And I do think young people, that is one of the good things I'm seeing with social media is there's a shift in the conversations. And it's almost this, what do you mean you don't have a therapist kind of attitude, at least in some
normalizing it now.
Yeah.
Which is a good thing.
Yeah. Mm-hmm. And, in terms of saying like, this is real and we can do something about it, I think that's great. There's also, though, some attitudes culturally I like to call it like the good vibes only culture. Like we should be happy all the time, which isn't physically or physiologically possible to be happy all the time. And so when we have these feelings that we label as bad, that just piles on. I tell teens all the time, just because life gives you a cactus doesn't mean you have to sit on it. And I got that from a Facebook meme, full disclosure. But the point being, sometimes we add to. And so if you're already feeling anxious and then you're saying, but I shouldn't be feeling this way, this is bad, then we add to it. We pile on, sit on that cactus. So I think, and then there's also this pressure to, like, I think back in my day, we weren't as busy. We weren't as overly scheduled. We had downtime and teens don't. Now their school starts so much earlier. The homework load is heavier. They're in so many extracurriculars. And that just, I think, is a breeding ground for anxiety. And it's all this, you got to do this so you can get into college and get a good future, and juxtaposed with, hey, the world is kind of falling apart. So how are teens not anxious, I think is really a question right now.
Right. And there are two things there that kind of stood out to me. One is that academic pressure seems to be at an all-time high. And that has contributed to a lot of anxiety, a lot of suicidal behaviors and suicides in young people as a result of that pressure. And then with access to technology, bringing that piece in again, there's also teens who are self-diagnosing and over-pathologizing the normal stress that we talked about earlier. And now, I'm anxious or I have an anxiety disorder because of that stress. And we know that there can be good information that's shared on TikTok, but there's a lot of misinformation as well.
Absolutely. And that's like the bad side of it, right? Is that people are over pathologizing normal things or using anxiety as a crutch. I can't do that because I'm anxious. And I don't believe that from a professional standpoint. I think, yes, anxiety can be one of the most debilitating medical conditions there is, especially if we're talking, severe OCD. And it's highly treatable. So I don't ever want to see anxiety being the reason. Yeah. So we need to be saying, yes, you're anxious. This is real. It's hard. And you can do hard things. And we're going to give you the tools. And this is how we do it, because we need to equip our kids with resilience. They have to be able to bounce back from hard things. No one gets through life without hitting some sort of obstacle or adversity. And so when we can really, I think, build that resilience, courage, and willingness to do hard things, I think we're setting teens up for success.
Yes. And that resilience means, what you've mentioned before, building psychological strength. And what does that look like? For parents who might be listening, for, grandparents or aunts and uncles who want to kind of strengthen their teen and help them to build that resilience and better manage anxiety, what can they do? We're going to talk about treatment, but what can they do at home?
Absolutely. So there's so much stuff that you can do. So one is get in the right mindset that anxiety is not dangerous. So we do not need to protect our kids from feeling anxiety or discomfort. So I think a lot of parents have this idea that, good parent means that you want your kid to be healthy, happy, and safe. Of course. If you have a kid who's prone to anxiety or an anxiety disorder, that's going to backfire on you. Because if you go through I almost picture like going in front of your kid, clearing the path for them. You're trying to make them feel happy, take their anxiety down, but you're keeping them from learning how to deal with it. And it will actually get worse over time. It's like, if they have a mosquito bite and it's like, oh, it itches, and you scratch it for them, it might feel good in the moment, but the more you scratch it, the more it itches. That's with anxiety disorder, like with disordered anxiety. So we have to start to reframe that and say, it's okay for my kid to struggle and to feel anxious. I'm going to support them, but I'm not doing it for them. So that's one just mindset piece. It's like going to the gym. You can't go to the gym for them. They have to lift the heavy weights if they're going to get stronger. There's a couple other pieces I think are really important. One is to learn everything you can about anxiety. There's a ton of good books out there, good podcasts and YouTube videos. Learn what you can, because the more inside knowledge you have, the better equipped you're going to be. And then start to separate your child from their anxiety. When I'm working with people in a clinical capacity, I label it, that's anxiety talking or that's OCD. And I start to separate it from day one. I also do it just broader than that, of that's your mind. Your mind is telling you can't do that. What's real? So when we can start to separate out, that keeps you from taking it as personally if your kid starts melting down because they're anxious. Oh, anxiety is throwing a fit. So I'd say that model good coping skills. So if your anxiety is unchecked, not to add one more thing to worry about, but if kids learn by seeing, so you can't say you need to, be brave or boss back your worries if you're not doing it as well. So it's okay to say, I'm really stressed, so I'm going to take a deep breath and tell myself it'll be okay. Kids don't see the good coping that you do because you do it internally. They're only going to see when you're not so great coping breaks through. So articulate, this is what I'm doing, or I'm really worried about this, but I know what if is a worry. So I'm not going to pay it any attention. So if you can start to model being brave, doing hard things, coping, that's great. Oh, there's so much we could go. I want to be mindful of time and things. There's so much more we could talk about it. But I guess one of the big things is when it comes to anxiety, we need to confront it. We need to face fears and recognize no one's died from embarrassment or making mistakes or being late or touching a doorknob. So whatever it is that's triggering the fear, often the best medicine is to face it and realize, oh, I can handle that. And so the more parents can lead their kids in that way and not accommodate, which means like tiptoe around the anxiety, the better.
Yes. And modeling the strategies for addressing anxiety is so important for all the reasons you just said, because they see you utilizing those strategies and see that it is effective, that you now feel better, you feel more calm, you're better able to think this through. And oftentimes they need that behavioral example of managing anxiety to really help them to process it. And, those are some things that parents can do at home. And I know that there are a number of different things I'm going to, connect you with our listeners at the end of this episode. But I'd love for you to explain some therapeutic strategies. So if parents are saying, I'm doing this at home, but they really need a higher level of support, I really want to connect them with a therapist. And oftentimes that therapy process is not well understood by parents. They don't know what's going on in the therapy room and how it would be helpful. Can you explain some of the therapeutic strategies that are used in treating teen anxiety?
Yeah. So part of why it's so confusing is because therapy isn't regulated in quite the same way as other, say, medical fields where, if you have your primary care doc, but if you have allergies, you see a different specialist. And if you have cancer, you see the oncologist. And it's kind of like that when it comes to mental health, but people don't know that. And anybody can say, oh, I treat anxiety, but they might use different tools. So when we look at what's most effective for anxiety, I would look for therapists who practice what's called cognitive behavioral therapy or CBT, or I would look for acceptance and commitment therapy, which it spells out ACT, but we pronounce it ACT. And these are evidence-based treatment approaches, which means science has shown that they're effective and they work quite quickly in comparison. So, I mean, nothing is a magic wand. It's not going to be a one session poof magic pill, but typically you can start to see some change even in a handful of sessions, 4 to 6 sessions, but the typical is more like 12 to 16. And that's not to say, oh my gosh, my kid's been in therapy for more than 16 weeks. This is a bad therapist. There are other approaches and extenuating circumstances, but these targeted skills and CBT and ACT they're very similar, but they're both skills based of what to do with difficult thoughts like worries or obsessions and those negative thinking, and also what to do with your actions so that you're taking helpful actions that are going to build resilience instead of feeding anxiety, and how to handle just the physical and emotional aspects of anxiety. So some tools to regulate, which is like calm your nervous system, kind of put it back in check. So those are great. If you're looking for books, I would be looking for books that mention those same terms as well. And there's great ones out for teens, for parents, and of course for clinicians too. But these are the place that I would start. Medication is an option, and some teens respond really well to the medications. They're called SSRIs. Most people know these as antidepressants. Even though it's called depressants, it also works for anxiety. And those can be helpful as well. But if I had to pick between therapy and meds, I would go therapy because it tends to be more effective, or at least put them together. And if you're going to do medications, also be skill building so that at some point we can take the medicines away and still have the skill. So I think of medicines as sometimes like those floaties that you wear when you're learning how to swim. They keep you from drowning till you get the skills down, and then you don't need the floaties anymore. And that's best case scenario with medicines.
Yes. And I think one of the things you said at the beginning is that anxiety disorders are treatable. They're highly treatable. So often the biggest step is getting teens into therapy so that they can get the treatment they need in order to build these strategies to have access to these tools that will help them to manage their own anxiety and become more resilient. One of the things that may come up for parents is that sometimes they're seeing their teen's anxiety and seeing that it is really interfering, but the teen might not be seeing it or may not be ready to get into therapy. How do parents bring up that conversation about the possibility that therapy might be helpful for their teen?
So one thing that I think is really cool about the anxiety world is you can actually treat teen anxiety without ever meeting the teen if you have parents or caregivers willing to participate. So Dr. Ellie Leibowitz and his team at the Yale Child Study Center, they've pioneered an approach called SPACE, and I think it's supportive parenting for anxious childhood emotions. They have a manual out that you can get, and there are providers around it. It can be kind of hard sometimes to find a provider who takes a SPACE approach or uses another term that gets used as strategic pressure. There's a group out of St. Louis that pioneered that. But that's the really cool thing is your teen doesn't have to be on board if you are, because the way you respond to your child's anxiety can shift it, right? It can feed it, make it worse. It can help it and make it better. So that's an option. The other one is to start to bring up, not in the heat of the moment, if your kid is melting down, whether it's an anger meltdown or I'm sad or a panic attack, high emotion is not the time to have hard conversations. It is not the time to try to use logic because they're in a different part of our brain that logic doesn't apply. So that's the time to disengage and just say, I'm here when you're calm. That's it. And that's hard. Parents don't want to walk away, right? We want to try to you cannot fight your way out of emotion. So have it during a calm time and say, I noticed that XYZ, and this seems really hard. And there are some options. It doesn't have to be this hard. Would you be open to figuring out some ways to make life feel a little bit easier for you? And I think we have to approach it without judgment and without shame and without anger. And that's hard because it's really hard to parent an anxious kid. Parents tend to vacillate between kind of being broken heart, like, oh my gosh, my kid is really struggling. It tears me up. And then we tend to be overly accommodating. It's okay, sweetie. You don't have to do that stuff. Or parents get angry. Suck it up. Just do it. I'm tired of this. And then they push in an unhelpful way. And we need both of those are completely understandable and neither is helpful. We need kind of this in between. It is real and you can do hard things. And that sort of non-judgment, non-angry approach to it.
And the point you just made really highlights the fact that parents need to support their own mental health, because it can feel really heavy when you have a child, a teen who is struggling with their mental health, who has the anxiety that's interfering, because as a parent, you want the best for your child. You want them to be able to enjoy the world and their relationships and their educational experience. And when you see that they're struggling, it can feel very heavy. And how can parents support their own mental health while helping their teen? Because I think that's such an important piece as well.
You're absolutely right on that one. And it can also feel really isolating. Like, I know when I talk to parents of teens with OCD, which is a poorly understood condition, and especially when it gets really severe, there's all kinds of things. And then there becomes a lot of shame on the parent side. What am I doing wrong that my kid is like this? Or when there's school refusal, which is often driven by some anxiety. And it's easy because parents really do encounter judgment from other people. Why isn't your kid at school? And I'm like, oh, they don't understand what you're going through at home. Yes, your kid we need to figure out how to get them to school, but I know those battles and what it can look like. And so I think finding support groups can be really, really helpful. And there are organizations like the Anxiety and Depression Association of America, which is adaa.org. They have a ton of webinars and blog posts and support groups online for free. Great organization. Members like myself and tons of other people who specialize in this create these resources. And so they're going to be quality and scientifically backed. Being open and talking to people. The number of parents I have who, they're getting calls from school every day about their kids or the failing grade notifications or whatever it is. And they feel like they can't talk to their friends or their family because they're worried about how their kid's going to be viewed or how they're going to be viewed. And I would say, you have to talk. You have to have some support. And then you have to do the things that do take care of you. So it's okay to set things down sometimes and say, I'm going to go take a walk. Because if I don't, I'm going to lose it, right? Like, go take a walk or yoga or read or paint or mow the lawn or whatever it is that gives you a break and helps you cope with stress too, because it is very difficult.
And they have to not fall into that comparison trap that we talked about earlier, because it doesn't only apply to teens, it applies to parents as well, because they're seeing their friends or neighbors posting first day of school pics and everybody looks so excited and happy to start school, and their child is dreading that, or they're performing in a play, or they're going to prom, and you may have a teen who's avoiding all of those activities. And so it can feel, like you're saying, isolating and painful. And getting that support. And sometimes that means therapy for the parent as well, in addition to joining support groups.
Absolutely. Absolutely. It is so hard to see those. And then that gets back to parents also need to be very mindful of their relationship with social anxiety. And I recommend almost always to take in less. Spend less time on it, because when you see that stuff, even if logically well, that's someone else's highlight reel compared to my behind the scenes.
Right.
Logically,
right.
You know that, but that's not what it feels like. And if what you're seeing is all of those, first day of school pics with smiles and prom pics, like, it's going to feel painful.
Dr. Ashley, I cannot thank you enough for sharing your wisdom with us today. It feels like we could spend another hour or more talking about this topic. And I know our listeners will find your advice practical, empowering, helpful. If they want to connect with you to go deeper for a consultation, to get support for their teen, what is the best way for them to reach out to you?
Yeah, there's a couple options. So I want to be upfront that I'm not doing one-on-one clinical work anymore. So I'm not taking on any patients, but I am connected to the anxiety world. So happy to help find referrals, because that can be a hard thing. So I'll throw that out. So email is great. It's Dr. Ashley at drashleysmith.com. My website is a great way. There's a contact form there as well, and that's drashleysmith.com. And then on social media, it's at Dr. Ashley Smith. So pretty easy to find. Happy to connect with resources, to share books and videos and point you to the right place. I'd also highly recommend ADAA.org that I mentioned. And if your child has OCD, the International OCD Foundation, which is IOCDF.org. It's great resources, as does NoCD, which is NOCD, and I think it's .com.
Wonderful. And I'll be sure to share all of those resources and your contact information in the show notes. It's been so great talking with you. And like I said, I know that this is going to help a lot of people. So thank you.
I hope so. Thank you so much for having me.
Thank you so much for joining us. I hope you learned a lot from this episode. I want to remind our listeners about a special opportunity to dive deeper into this topic. We've created an 8-session youth anxiety mini course specifically for parents. This course provides tools and strategies to help you better understand and support your child or teen as they navigate anxiety. It's available now for just $47 until the end of the year. You can learn more and enroll at childnexus.com. Thanks again to Dr. Ashley, and thank you to everyone listening. I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.